Alright guys, so this lecture is the first lecture in the medical terminology portion of the medical office support class here. I know we've been going through daily and doing our medical terminology reviews and our practices every day throughout the program, but now we're really getting into the focus part where I have to give the lectures and give you guys the in-depth meanings and explanations of the words. So some of the things we're going to talk about today is just being able to divide medical terms into their component parts. So we need to be able to analyze words by dividing them into component parts, relate the medical terms to the structure and function of the human body, and then be aware of any spelling and pronunciation problems that will exist with some medical terminology parts. So first off, let's start with the important word parts. Now with medical terminology, there are really like 4 or 5 main terms here. The root is also known as the stem. It gives the word the essential meaning. It's most generally in the center of the word if there is a prefix, a root word, and a suffix. But most generally, it is the most essential meaning of the term, and most generally it relates it to an anatomical position or body part. The suffix is the ending of the word, and all of its function is just to alter that meaning of the root or that stem of that word. A prefix is a small part added to the beginning of the term. It's much like the suffix. All its job, duty is to alter that meaning of the root word. Then you have your combining vowel and your combining form. Now the combining vowel connects the roots to suffixes and other roots. It has no meaning. Okay, it's used as a bridge to make pronunciation easier. So most generally it's an O, and we'll talk about that more when you see these words in the future. The combining form is the combination of your root with the combining vowel. It's not an actual part of the word of a medical term, but it is. It might be sitting by itself. And all the words and the roots that we go through today, they will be given to you in combining form with the O attached to it as well. So here's some general rules to building medical terminology. The first thing you need to do is read the meaning of the medical term from the suffix back to the beginning of the term and then across again. So whenever you start reading medical terminology, read the suffix first. Read the suffix, then go back to the beginning of the word and read across back to the suffix. Alright, drop the combining vowel before the suffix, beginning with a vowel. Okay, so if your suffix starts with a vowel, for example, itis, as they give you here, you don't need to put that O for the combining vowel in front of it. So it should be gastritis, not gastroitis. Okay, that O is irrelevant. It is unneeded for pronunciation needs. And then it's important to keep the vowel between word roots. So if a medical term has more than one root or stem in that word, you need to keep the combining vowel in between those two terms. So here you can see in your lecture that's provided to you guys, you can see that you keep the O between gastra and enter in the term gastroenterology. It's pronounced gastroenterology, not gastroenterology. Okay, there's a difference. So let's talk about word division and how words are built up. So the example they give you here and in your lecture and on your PowerPoints is electrocardiogram. Now, electrocardiogram means the electrical activity of the heart when you translate it directly. So how we break that up? We have electra is the root. Okay, it means electricity. Okay, you have O, which is a combining vowel. Cardi is another root. So this word has 2 roots in it. You have another combining vowel O, and then gram is a suffix. So combining those all together, electrocardiogram has a root word, combining vowel, root word, combining vowel, suffix in that word. And again, electrocardiogram is a record of the electrical activity or electricity or electrical activity in the heart. Another example is subgastric. Okay, so you have a prefix in this one. Prefix sub means under. You have gastra, which means is a root word or a stem, and it means stomach. And then you have ic, which is a suffix, and it means pertaining to. So like we said, when we read these medical terms, we start with our suffix first. Pertaining to, under, the stomach is a direct translation of that word. That is what that means. Okay, so let's get into the combining forms that you will see. So remember, guys, combining forms are your word roots or your word stems connected or combined with a combining vowel. So the next couple slides are just going to go through, and I'm going to go through proper pronunciation of these words and give you the meaning. Adeno means gland. Arthro means joint. Bio means life. Okay, when you think of something, think of like biology. Okay, the suffix logy means study of, so biology is the study of life. Carcino means cancerous or cancer. Okay, an example of that would be like carcinoma, which would be a cancerous tumor. Cardio is heart. We talked about an example of that already. Cephalo means gland. Cerebro is the cerebrum, or the largest part of your brain. Cysto refers to the urinary bladder, while cyto means cell. See, that's careful. All it is an S difference between cysto and cyto. So you need to be aware of that when really dissecting these terms. And then the first term that means skin is derm, or dermo. And then you have dermat, or dermato. That also means skin. So you got to be careful when building these medical terms to use the proper one. Electro means electricity, as we said. Encephalo means brain. So be careful that cephal means head. Encephalo means brain. So that's the one to be aware of. And entero means intestines. It often just refers to the small intestines there as well. Urethro. Urethro means red. Okay? Gastro means stomach. Nos means knowledge. Okay? Like diagnostic testing. Gynecologist or gyneco means woman or female. So a gynecologist, okay, the suffix logist means a specialist or doctor or something along those lines. So it'd be a specialist for women would be a gynecologist. Hemo means blood. Hemato also means blood. Okay. Hepato means liver. An example of this would be like hepatitis, which would be inflammation of the liver. Leparo is abdomen. Okay. Leuco means white. You see that in like leukemia. Nephro would be kidney. We have neuro, which means nerve. Onco, which means tumor. Ophthalmo, which means eye, osteo means bone, and patho means disease. Okay, so a pathologist or pathology. Pathology would be the study of disease. Pathologist would be the person who studies disease. So it's important to know that. Psycho means mind. Reno means kidney. Rhino means nose. Okay, rhino, those are close pronunciations. It's important to know that. Sarco means flesh, and thrombo means clotting. Then we get into our suffixes. Now again, suffixes attached to the end of the words, and they alter the meaning of that word root. So some examples of this. You have the suffix al, meaning pertaining to. This could be used as like neural. That would be pertaining to the nerves. Algia, the suffix algia means pain. Okay, that could be used in a word such as arthralgia, which means joint pain. Site means cell, and that could be used with leuco. So you create leukocyte, which is a white cell. And then you have ectomy, which is the cutting out, removal, or excision of. So gastrectomy would be surgical removal of the stomach. So it's important to know those. Emia, some more suffixes. Emia is a blood condition. So leukemia is a blood condition of white cells, okay? Globin is protein. Hemoglobin would mean protein in the blood. Okay. Gram is a record of, we already talked about this, but another example might be arthrogram, which would be a record of the joint. IA is condition of, okay, so neuralgia would be a condition of the nerves. And then IC means pertaining to, and you will have a ton of these guys that mean pertaining to throughout the course. So really take note of that and know that there's more than one word that means pertaining to. But IC can be used in like gastric, which would be pertaining to the stomach. Some more suffixes. Ism, like hyperthyroidism. Ism means condition or process. So hyperthyroidism is a condition or process of an overactive thyroid gland. Hyperthyroidism. Itis means inflammation. We've talked about that one a little bit already today. Itis means inflammation, and you might see this in like the word we worked on already, gastroenteritis. So it's good to see that. Logist, as we've talked about a little bit, is a specialist in the study of. So a neurologist would be a specialist in the study of nerves. And then you have logy, which is the study of. So you have a nephrology, would be the study of kidneys. So it's important to know these differences, guys, and how one or two little letters can completely change the meaning of a word. Some more suffixes. Oma would be a tumor, a mass. So we could combine that with carcin and get a carcinoma. Okay, it'd be a cancerous tumor. That's how that would work. Opsy is the process of viewing. So like a biopsy. Osis is an abnormal condition. So look at nephrosis, would be an abnormal condition of the kidneys. Scope is an instrument used to visually examine. Okay, so think of gastroscope, which would take a look inside the stomach. Would be a tool or an instrument used to look inside that stomach. Some more suffixes. We got scopy. Now scopy is a process of visual examination. Don't get that confused with scope. Okay, scope is the instrument used. Scopy is the process of actually looking. Okay, so laparoscopy would be looking inside the abdomen. Cis means state of, so like prognosis. Tomy is cutting into or an incision into, so like a neurotomy would be cutting into a nerve. So now prefixes, very much like suffixes, however prefixes sit at the beginning of word and they'll alter that meaning of that word root to give it more of a meaning. So here are a couple prefixes for this first chapter. You have a or an, which means no or not. Okay, so that could be combined with that suffix emia to get anemia. Okay, and anemia directly translates to a blood condition without blood. Okay, so it's important to know that. Aut means self, so an autopsy. Dia means complete or through, like diagnosis. Dis means bad, painful, difficult, abnormal. There's a lot of meanings to dis. It's an important word. You'll see it a ton. Dysentery would be an example of that. Endo means within. It could be like endocrine glands. That is an example of the endo prefix. The prefix exo means outside. It could be the exocrine glands. Okay. Hyper is excessive, more than normal, too much. So think of hyperglycemia, which directly translates to a blood condition of excessive sugar. And then hypo is the exact opposite of hyper, so be aware of that. Hypo means below, less than normal, or under. So hypoglycemia, which can mean a blood condition of low blood sugar. Peri means surrounding, so pericardium means surrounding the heart. Pro means before or forward, so like prostate gland. Re means back, so resection. Retro would mean behind, so like retrogastric, so behind the stomach. Sub would mean below or under, so subhepatic, below or under the kidney. Below or under the liver. And then trans would mean across or through, so transurethral, through the urethra. And then just, of course, a little medical scramble here. Pertaining to the heart, it's all scrambled up, means cardiac. Nerve pain, okay, nerve is neuro, pain is algia. Okay, so combine them together, you get neuralgia out of those letters. Deficiency of hemoglobin causes this condition. That condition would be anemia out of those letters. And then just a couple more here. The study of cells, the study of would be logy, the suffix logy. And then cells would be cyte, so it would be cytology. Infants that are often born in this position are head first. So, the word root that means head is cephal. Okay, infants are born in the cephalic position. Okay, so that word is cephalic. And then inflammation of the gland would be adenitis. Itis is inflammation, aden is gland, so together you get adenitis, A-D-E-N-I-T-I-S. And then, of course, all those words together gives us a bonus term for a malignant diagnosis, and this is going to be carcinoma, which we've talked about more than one time in this lecture, and it means cancerous tumor or malignant diagnosis. So that is your first chapter of medical terminology. Most generally, it should be a review for you guys. Bust out the Quizlet, enjoy the study guide, and then be ready to take your test over this lesson shortly. Continue to work hard, guys. Have fun.